All right, Zach, you want to go ahead?
Yep. All right, guys. We got who we got here. We appreciate you guys coming in to or joining us tonight for this little topic. Zack Hill, originally from Ohio, Mountain Indy Foot and Ankle Fellowship over here. So certainly happy to answer questions about that specifically later on. But as Trent mentioned, kind of the focus of our stuff here today is a little bit different than kind of what we normally do. More so centered towards students, residents, whatever, but kind of encompasses a couple different groups. But basically, my job today and doing a fellowship currently is kind of sharing with you some pros and cons of each. Sorry, my dog's crazy. Hey, stop. Hold on. Sorry about that. Anyway, pros and cons more so on the fellowship side and giving you a idea of all that. So certainly we'll answer some questions at the end. So if you think of any, just let me know. This is meant to be more of an open forum. All right. So kind of the overview. This is not to disparage getting a job right away, because I think we every person in this panel that is doing fellowship, I'm sure at one point thought about doing a job, just kind of worked out in this way. So I'm pretty much going to highlight the things I think are beneficial from fellowship, and then Trent's going to do the same for jobs, and then we'll kind of come together at the end. But overview here, fellowships have been around for decades, recently expanding pretty rapidly. There's a lot of fellowships out there now. Both paths, I want to stress this enough, both paths are valid, and you cannot be wrong in the choices that you make with either job or fellowship. Um, my goal here, like I said, is to highlight the benefits of the fellowship while kind of recognizing some individual career goals. So, once again, overview of fellowships. As of 2024, there are 53 podiatric foot and ankle fellowship programs recognized by ACFAS. Even more of those, there's probably a handful, probably 20 to 30 that are not quote unquote ACFAS approved. So there's at this point over 100 fellows in our field right now. That does not include orthopedic foot and ankle fellowships, which some podiatry residents do go on to do. So that is also an option, though not as common. It's been done, and we know of people that have done them in the last few years. So that's kind of an option as well. So some decision factors when you're pretty much getting into, your first, second year of residency, what are some things that you want to look at when thinking about a fellowship? And that's, one, what are your career goals, whether that's being in academic medicine, what do you want to do, private practice, hospital based, do you want to work with industry, etc. These are things to think about. What is your critically reflecting on your skills and what's your comfort level, surgically, kind of clinically as well, and being honest with yourself is a big thing. Other financial considerations, which we'll get into, work-life balance preferences. Are you someone who wants to, you don't plan on having a family, you want to work all the time, or you want to work less? It's kind of a double-edged sword here. So, and then other geographic preferences, whether you want a foot in the door somewhere, that's also some things to consider with fellowship. So I'm going to go over some of the benefits, and this is mostly my perspective, but I feel like I've gotten a pretty good perspective of others that are doing fellowships too, that are in my class and have come before me. So I don't speak for everybody, but I think this is kind of a general consensus. At first being advanced surgical training, exposure to complex cases not commonly seen in residency. Not all residencies are created equal. It's more so what you're looking to get out of it. Other things include mentorship. There's potential for more so one-on-one training with experienced surgeons in residency. Like I said, it just depends on where you're at. Are you looking for something a little bit more individualized to you? Increased autonomy, with support. So it's just each year you go in this training process, especially in fellowship, you get more kind of autonomy, more freedoms to do so, but still under that guidance of a mentor and academic and research opportunities. So some fellowships do more than others, but you have access to research, publishing, teaching.
Hey,
Maybe it's something that you didn't get in your residency experience that you want to get further in fellowship. Those are other doors and opportunities. Job marketability, so it gives you kind of that competitive edge for high volume or academic positions. Some now are strictly looking for fellowship trained, whether that's right or wrong. I'm not here to argue that, but there are have been instances where I've looked on job postings within the last year or two, and they do say they want somebody that's fellowship trained. That doesn't mean that's right, but that's something to think about for the future. Networking and professional development, so connections with leaders in our field. We do many fellowship labs throughout the year, and you can kind of network with different people in those. And I know people who've been granted some job opportunities through those, so just things like that. And then, yeah, so those are some of the big benefits and highlights that things that I've seen and kind of come to know from other people's perspectives as well. We touched a little bit on kind of financials, and obviously this is a big thing for some people. Some people it's the surgical training, some people it's a combination of that and wanting to get the job they want, and then the finances that come with that. So not saying anything's right, but this is just something that's been put out there that you all can look up. Is there financial implications for doing a fellowship? Like, is doing another year training, another year away from maybe family or making the money you want to make? Is it worth it in the end? So, this paper that came out from Rushing and Hires Group a couple years ago, they looked at financial outcomes with and without fellowship training over a 30-year span. And basically what I'm not going to read all this to you. You guys can screenshot this if you want, but basically they say pursuing a fellowship in advanced reconstruction is an acceptable financial investment. There is a little bit more on average over the 30-year span that fellowship trained are making, but I would, looking at these numbers, I wouldn't say it's a significant amount. You can still make really good money not doing a fellowship, but it all depends on some of the other factors we talked about too. So there is a benefit, and it's been documented, but like I said, take this with a grain of salt too. Word to the wise. So, um, some things as far as looking for fellowships and what I've come across, and like I said, other people's experiences is not all fellowships are created equal. Fellowships, what that means is, each has a different focus, each has, maybe more call responsibilities. Some might be more limb salvage, some might be more reconstructive, some might be have more nerve surgery, things like that. So really what that boils down to is do your homework when you're looking at these fellowships. I'd say at first you can cast like a wide net to really dive deep and leave no stone unturned if you're really going to go into it. But really do your homework. Just because it's a fellowship does not mean it's something worth you specifically doing for another year. And I know some people that have been burned by that, not saying that all fellowships aren't great, but definitely do your homework. I think I can't state that enough. So some myths versus reality. You won't make money during fellowship. That is not in fact true. I don't know of any fellowships that don't offer money. Now, you might make a little less than what you made as a PGY3 actually, but usually depending on state, it's usually pretty similar. So that's another thing to think about. It's another year of making that money, but as we saw, you could potentially have a financial gain at the end. Um, so something to food for thought. And then also another myth of fellowship is that fellowship is only for those who aren't confident in their skills. I'd say that's absolutely not true. I know plenty of people who have done fellowship or are in fellowship currently that have come from really good high surgical volume programs, and it's all come down to what you feel is best for you, whether it's more reps in certain areas that you want to get good at. But I would say, I think some people have this idea or dogma that they think just because they're doing a fellowship, it must mean that they had poor residency training. I would say that's quite the opposite. I think you can never know too much. You can never have too much experience, especially with what we do. But once again, that's not to say that going out and doing your job, if you feel comfortable in doing so, is not the right move. So, um, you can't get a great job without fellowship. I once again do that's a myth. Like you can I know I mean Trent's in Dr. Leo is a perfect example. He is he's very good at what he does. He's confident. He got a job. He has a great job lined up. And I know plenty of other people from our class and classes beyond that have gotten great jobs without fellowships. Like I said, fellowships can open some doors for you, but um, so can kind of doing jobs and networking in that way. So fellowships, when might be the a job right out of residency be the better choice. If you already are confident and have, a strong surgical foundation where you feel like this is what I want to do in practice. I've had plenty of hands-on reps with this in residency. I feel comfortable working these things up, then by all means, a job right outside is great, but you got to work for that as well and do your homework with that too. If your financial priorities at the time outweigh the additional training, like I said, you're pretty much still making a resident salary while you're doing your fellowship, and oftentimes it involves you moving to select areas of the country that might be a little bit more expensive than what you can handle at that point in time. So those are the other things to consider. If you do have an ideal job opportunity that presents itself immediately, by all means, you can talk to those folks, and that's a great opportunity. And you definitely, in the stage where you guys are at, want to, like I said, leave no stone unturned and talk to as many people as you can. And if you have a great opportunity that you feel is right in your heart, um, then that's something you should do. And then if work-life balance, a lot of people in our profession have kids at this point in training or a big family, so if that's more important at that point in time and working takes the priority, then by all means that means something that you should do, and that's more important. So I just want to give a quick note. I know a lot of people have questions about like, hey, when should I start doing all this stuff? When should I start looking at fellowships? How do I know? There's so much uncertainty with it. It's not exactly like the residency process, but just a note on the timeline. So as a student, I'd say it's not something that you really want to concern yourself with until you get in. It's okay to have ideas about different things, but and look forward a little bit. But each year, I think you should hone in more, even if it's not something you're super crazy on doing. I think you should at least do a little homework on it. But first year residency, focus on your training, hone your skills, build your CV, do research, talk to different colleagues and places at different programs, talk to as many people as you can, attendings, classmates, whatever. This is your time to, it's going to be busy. It's one of your busiest years that you'll have, but that's the time to get everything kind of ramped up as far as your skills, research, whatever that might be, your CV, because then as you get kind of more responsibility but less grunt work as you go, then you can start diving more into the specifics. So second year residency, really kind of deep dive into yourself. Is fellowship for you? Answering some of those questions we asked earlier. Is it something that you feel like you're going to need? At that point, it's kind of hard to have that introspect, but I think it's necessary and it's something you have to balance. But this is when you're really doing your homework. So even if on the fence, do your homework, compile a list of programs that you might like, shop around for job openings as well at the same time, and then network. That's the biggest thing. November, December of your second year, call and speak with past current fellows, the programs that you're looking at. If you're still thinking of fellowship, then narrow your list at this point in time. Continue to kind of figure out all things about those programs and even jobs at the same time. Second year should be a good year for you to attend ACFAS and network as well. Like I said before, all programs are different. Applications are at different times. It's not a standardized process, so stay organized and apply early would be my biggest advice to you guys. And then at the end of the day, do what you feel is best. Like I said, Trent and I, we had training at the same time. We had pretty similar training from school to residency, and it's just kind of what we both felt was best for each other. And that happens all the time. And I'd say we're both doing pretty well. And so you really can't go wrong. And I can't stress that enough. But so some key takeaways from the fellowship side of this is both paths lead to success. You know, it's a subjective decision based on what your personal and professional goals are, some of which we talked about. Fellowship can provide enhanced training, mentorship, networking, and job flexibility. So if those are things you feel like you're lacking at current when you're a resident, then something to at least give consideration to. So if unsure, consider your comfort level with surgical cases, your career aspirations, and financial
Yeah.
situation. There's no wrong choice, just the best choice for you. So with that, I know Trent will be going here shortly, and we can do a lot more questions and answers at the end. But does anyone have any immediate kind of questions about any of what I just presented? And certainly you can save some for the end too, if that's what we want to do. But
Cool.
thanks.
Good stuff, Zach. All right. Zach's my PowerPoint up.
Yes, sir, it is.
All righty. Only got about 13 slides worth of stuff here, and Zach's already kind of, to avoid a little overlap, Zach's already kind of harped on, the kind of similarities, differences between, fellowship versus job training. For those who don't know me, my name's Trent Leo. I trained at Eastern Virginia Medical School. I graduated in June or July of 2024. I'm now with foot and ankle specialist of Central Ohio, based out of the greater Columbus area. I'm just going to kind of jump into this here. Zach has already hit on this, but there's such a big decision to be made here, and it's really kind of just dependent on what's good for you in your scenario. I had a wife, we had a dog, trying to start a family here, and for us, kind of getting a jump start on that and being comfortable with my training, I just kind of, it was ultimately, a joint decision to say, hey, do we want to go put things off another year? Do I get some more training? And then, who knows after that? But for me, I've had an opportunity to pursue a job in an area that I really like, as well as my wife. So for us, the level of training kind of coupled with, the right job at the right time, that was kind of our reasoning for going ahead and foregoing fellowship. That being said, I was interested in fellowship. I toured and revisited fellowships my first and second year, and just kind of ultimately through a second year process, just determined that that wasn't the route for me. So some kind of more deciding factors. That Zach kind of harped on most of these, but certain comfortability with certain procedures. Not all residencies are created equal. Some you have more peds in, some you have more recon, some you have trauma. But ultimately, some fellowships do definitely focus on some certain subspecialties, such as peds, Charcot trauma, recon and limb length, as well as total ankles. If that's something that you're really trying to hone in your skills on, and if you didn't get a lot of those in residency, certainly fellowship's definitely more of a route for you to take. For me, I really enjoy doing kind of all facets of foot and ankle, even including the diabetic foot stuff. I know it's not sexy, but at the same time, that's where you're going to get a lot of your patients from, regardless of, how good of training you got. Is there are far more people out there walking around that are diabetic and need their nails trimmed, than people that need total ankles put in. So at least from a practice management standpoint, being familiar and being able to want to take all pathology that comes in your door is certainly important. The recognition aspect, I definitely think is, something that fellowship gives you an upper edge on, especially given that, a fellowship is associated with certain people's names. And Zach, Dr. Hill, Dr. Sweeney, I mean, they're at great programs where, their name of the attending that their fellowship is at, it carries some weight. So when you're going ahead and applying for jobs and they see that that name on a paper, it certainly adds a little bit of incentive to, going ahead and hiring one of them for a, more of a lucrative position. And with that comes the mentorship that Zach already talked about. You're usually in a one-on-one or sometimes two-on-one scenario where, that whole year is dedicated to you and building your skills. Where in residency, you can have 5, 6 residents in a program per year. So you're one out of 18 people in some cases. So to be in a position where you have that one-on-one training is certainly, something that's very lucrative in our field. So, kind of tailing more towards that job hunt is when and how to begin. I would certainly start at least looking midway through your second year. And I'm not saying start cold calling people, but at least get an idea of, how many jobs are in that area. You can do a Google search, and I'll kind of talk about platforms to go ahead and do that. But I'll be honest, the market really isn't all that great right now, especially where I'm at in Ohio. There's not a whole lot of opportunities out there. So at least starting to get a foundation of where you're at in terms of that search is definitely a good idea. And whether that be, location based, if you're looking for specifically a hospital job, we'll talk about, like I said, how and where to look for those certain jobs, but at least getting an idea of where you want to practice is something that, is quite important. Putting out feelers is certainly something that you can do is just say, hey, I'm going to be looking for a job in 2027, 2028. Any chance you guys would be looking to hire by then? And people can kind of give you an idea of, hey, we're actually going to be looking then, or no, get lost. But definitely not a bad idea to go ahead and at least start putting some calls or messages out there. A big resource for you guys when depending on where you're at in your training right now, whether it be as a student or a resident, is asking attendings either, at your school or at your residency if they know of places. It's a very small field that we're in, and I know that's kind of thrown around a lot, but it really is true where a lot of people know various people that have either, they've gone to school with, they trained with, and they're all in various parts of the country. So you never really know who's going to have an opening unless you ask. And then big point, being sure to do your research with other, either associates, people out in practice of companies to avoid. Unfortunately, it is kind of a dog eat dog world where some companies are going to look to capitalize on cheap labor, and they're going to be like, hey, this guy's been working for 65K a year. Why not offer him a couple, 10, 20 grand more, and let's just see if he can come work for us. So definitely do your research in terms of, companies that may not be the best ideal places to practice. So some resources here. I'm not going to, really read through all of these. A couple that I want to focus on, Indeed, LinkedIn, ZipRecruiter, those they actually do have a fair amount, but definitely look into those. If you're looking for hospital jobs, I would definitely recommend that you guys go to kind of more of a practice link or a Healthy Careers, which is basically partnered with ACFAS's website. So if you go onto the ACFAS website looking for a job, it'll kind of redirect you to this Healthy Careers website. If you're looking, doing a Google search and going on and seeing that, hey, I want to work in Chicago, you can just Google easily, Chicago podiatry opportunities, but also go ahead and look at the actual websites of those as well, because they may not just be spending that money on advertising. And they really want somebody that's interested in that area. So make sure you're looking at those practice websites themselves. Other state forums, SDN forums also have jobs, but definitely be careful on there too, because that's really not too monitored or anything. And then there's kind of the art of the cold call where, if you're really trying to look and zone in on an area, they have a hospital and you want to see if they're hiring. If you don't see anything posted, there's usually someone in the medical affairs office or some number that you can always usually call and see if there's anything that's possibly opening up when you're going to be graduating. So as I kind of alluded to, the market not great right now. There's at least in my area of Ohio. I'll show you guys kind of the research that I've done over the last week and just give you an idea of what's out there right now. And this kind of really emphasizes the importance of starting your search early and really planting that seed to see, hey, if I graduate in a year and a half, 2 years, is there going to be something there waiting for me? Is someone potentially going to be interested in hiring or waiting that long? Because with that as well, contracts can be extremely variable based upon if you're in a private practice, a multi-specialty group, a hospital setting, and I'll kind of go over that compensation stuff here towards the end. So this was, I think, on Saturday or Sunday when I was making this. So this was podiatrycareers.org. And like I said, this is ACFAS's kind of partnered website through Healthy Careers. So if you kind of just look for 40 or for ACFAS jobs, they got 21 kind of orthopedic surgery jobs, and those jobs will be listed under like foot and ankle orthopedic surgeons, such as this. And now that's not to say that, they wouldn't be interested in hiring a podiatrist, but that's just kind of what the listing is posted for. And then again, kind of look here, they're looking for a full-time board certified, board eligible person. When you're first graduating residency, you usually don't have that full board eligibility yet, but it's definitely, worthwhile throwing an application out there or reaching out and seeing, is this something that would be a potential fit for me? Because and I didn't really add anything to scroll, but you can kind of see here at the bottom that this job specifically is asking for a podiatrist, which there was only about 19 jobs sponsored through ACFAS for. Quick Google search here. I literally just looked up Ohio podiatry jobs. I think, like I said, I think this was last week or Saturday or Sunday. This is kind of the results that you're going to get. Oak Street Health, like they're an example of a recruiting firm. So this group doesn't have it listed as hiring out like this third party firm to kind of go ahead and recruit somebody. APP is just advanced practice person. Basically, I'm not even sure if they're going to be looking for an actual physician. That could be like a PA or an MP or something like that. But that's why it's so important to kind of go ahead and see, what's out there. So contracts, really briefly to touch on. I really, really, really recommend you have a trusted mentor, colleague, lawyer attending read this over for you. Because there's a lot of lingo and it's very, very easy to go ahead and get sidetracked and excited. And you see all this money and you see six figures on a paper. And then all of a sudden you're just like, wait, I didn't read my non-compete. I didn't read my jurisdiction guidelines. I didn't read, what benefits I have. So definitely pay the 300, 400 bucks it takes to have a lawyer read this over and basically do what's called an explain this to me in in layman's terms, a session where they just kind of go over the contract for you as if they were explaining it to a toddler. There are multiple different compensation methods, as we kind of alluded to. There's the RVU, which for you guys that don't know, it's basically kind of this standardized algorithm to where, each procedure, if I do a bunion, it's worth, 6, 7 RVUs. And that's just saying whatever an RVU is worth at the hospital that you're at, that's what you're going to get paid times that amount. You can have the salary and the bonus compensation, which says I'll pay you 200 grand. And then if you make over that in collections, we'll give you X amount of money. There's the straight collections, which basically says, however much you bring in, this is your cut and that's it. And then there's kind of the locums end of things, which is kind of like more of a temporary sort of ordeal where they're just hiring you for like a month or two at a time. And that contract, and I don't know of any positions out there that do that, but basically it's just saying, we'll hire you for X amount of months and this is how much money you get. Very, very important point for those who aren't familiar with kind of the credentialing insurance side of things. It takes about anywhere from 40 or 30 to 45 days for a claim to process after you see a patient. So that's from when you type your note, when you bill it, when the insurance receives it, and when they pay it out. You need to make sure you're obtaining at least some sort of sustainable income from a base standpoint while you're waiting for those insurance and credentialing process to go through. And I'll talk about that here further in 1 minute. Important factors, like I also talked about, your non-compete. If you're just taking a job just to take it and you're not saying, hey, I'm going to be out of there in a year or two, really not that big of a deal. But make sure you're looking at the mileage and the amount of years that you're doing that for until if you're wanting to stay in that area potentially. Benefits such as malpractice, CME, equipment such as lead, loops, stuff like that. Paid time off, obviously a big thing. Partner status if you're joining a private practice and you're wanting to buy into that group, as well as surgery centers, affiliations, and buy-ins is very, very important because those are all great kind of extra supplemental income sources, which are ultimately very crucial in kind of sustaining income outside of the clinic. Termination, make sure you're reading over that aspect, which talks about, what is with cause and without cause termination. With cause meaning, hey, you effed up and you did something wrong and we're firing you, versus a without cause, which is saying, hey, we're just firing you because we don't need you anymore. So make sure you kind of go ahead and have that ironed out because that's kind of important when it comes to the concept of tail coverage, which is quite expensive if you go to leave a place. There's also something called nose coverage, which I'm not going to get too far into. I'm happy to talk about that further if you have questions, but definitely know the difference between tail and nose coverage because it could be upwards of, 20, 25 grand in some cases, depending on how long you've been out. And usually the group that you're with is not going to pay that because you're basically leaving. So unless you can work out a magical way to get that covered, it's usually not. So to briefly touch on the residency to job transition, I highly recommend you guys at least give yourself 1 month to get situated, especially obviously if you're moving to a different area of the country. You usually bring in, significant other, a pet or babies with you. So definitely go ahead and take some time after residency to take that all in, go on a vacation, make a trip out of it, and just go ahead and take some time to care or spend some time with the people you care about because it's really going to get real once you're in attending, because you're on your own basically, besides your coworkers. Usually you're not with other residents unless you're at a hospital job or hired on by your residency. So it's really important that you just kind of go ahead and get that time centered out. So you go ahead and have that ability just to catch up on sleep or whatever it is that you need. And a big part of that too is the billing and the CPT coding. That's not something that I got a lot of in residency. I actually kind of had to work my own way and kind of learn that. Some programs definitely emphasize it, some don't, but that's definitely a big thing that I'd say fellowship would give you. A lot of the fellowships out there, they make you bill and code your own patients. So you kind of have that year to get familiar with, CPT codes, ICD-10s, the proper modifiers. And we've had talks about those in the past with steps. And then kind of to touch on the credentialing process, and this is why it's so important to have that, that base salary. This can take upwards of 3 to 6 months to get all of your DEA license, your medical license, insurances to get on, hospitals and surgery centers to be credentialed with. It's really, really important that you guys get that and you have that contract signed if you're able to. As soon as February or March, if you're graduating residency, that way you can kind of just jump into here and have, no issues really with getting and being able to see patients. Because when I first started, I was really only able to see Medicare and Medicaid patients. Commercial insurances just take forever to go ahead and get you credentialed. And obviously, that's a huge source of income that's going ahead down the drain because you can't see those patients. Some insurances do and will allow you to backdate your claims, but that's kind of a really gray area with that. And it's kind of an individual basis. So make sure you're kind of having your billing people check into that. Um, Other big thing is making sure you have a very qualified person doing this. For my first job, when I signed up, basically CareSource, which is a form of Medicaid, they had me credentialed like 6 times. They did it improperly all 6 times, and each time, basically, all my claims were getting rejected. So, you're seeing patients and you're not even able to bill for them because they're not even credentialed and an authorized user. So make sure you're making staying on top of that and having someone good take care of that. So, lastly, fellowship is definitely, I'd say, gaining more popularity over the last, 5 to 10 years. It's definitely, as Dr. Hill kind of alluded to, it's gaining more of sort of a requirement for higher end jobs. As there's definitely more cases than not that I've seen lately where it says, fellowship preferred or at least fellowship required. And then again, that's not to say that people can walk in and have the same amount of training, because just because you went to a fellowship doesn't mean that you were either A, doing the cases, or B, doing high end quality stuff that distinguishes you away from somebody that went to a high end program that did high volume and high diversity cases. So that is kind of a sort of a touchy subject too. As we said, all fellowships are not created equal. So making sure that you're confident and good with your skills is definitely the most important factor. So don't feel like you have to do a fellowship if you're feeling residency was adequate enough for you that you can take on just about any cases. This was my first case. It was a Charco recon, and I felt leaving residency that with my training and my attendings that I was able to kind of do what needed to be done, and I was able to treat mostly everything that came in my door. So for me, that's kind of why going into the job route was what was best for me. Utilize your attendings at your residency even when you're done graduating. I have the honest pleasure of just being very close with a lot of the attendings at my program. I call with them, I talk with them about cases. I ask what they would do. I see if they, have seen anything like that before. I work with a group that has a fellowship now, and we have monthly academics. So being able to kind of still even have that and just anyone to hear you out on an idea, because you can show the same x-rays to 10 people and they all tell you 10 different things. So just getting extra opinions is never a bad thing. Even if you were to go to a job, the training doesn't stop. You still need to read. You still need to look up research. You still need to publish research. And then having that fellowship residency connection is great to keep you on your toes. Because people coming behind you in fellowship that I'm going to be training are just as smart, if not smarter than I am. And they may know something or see something that I haven't seen. So that's a huge asset for me. And then again, kind of just beat the dead horse at this point. Each situation is different. Do what's best for you. Drown out the noise. Don't let anyone tell you that you need to go one way or another. It's ultimately your choice. So thank you guys for jumping on tonight. This QR code here for those who are joining us for the first time will take you to our website. Here's my dog Malibu. She absolutely loves bulb syringes. So I would always try and take one home from the OR. And she thinks it's the best thing ever. Other than that, I will open the floor for questions, either fellowship, job, general inquiries. The floor is now you guys if you have anything.
I got some questions for Zach. Can you guys hear me?
Yep.
Yes, sir.
Hey Zach, I'm actually looking into I'm PGY1 down in Miami, Florida. I went to Kent, so I studied a couple years under you guys. Um, I was looking at your fellowship program. How's your, I guess, opinions of it so far?
Oh yeah, I love it. Um, I'm sure there's some other fellowship people on here tonight too that can say the same. Every program is different. We're really recon heavy, a lot of trouble, triples, doubles, things like that. Some unique things we do, a lot more nerve surgery than I was ever exposed to in residency. But basically, you and I can talk more about specifics on it later, but I love where I'm at. It's a great place. We have like 6 or 7 different attendings that we scrub with frequently, and all are, some things are regional too. Like you get good regional training where you're at. I'm sure down in Miami, it's a lot different than what it is here in the Midwest. So some of that too is the benefit of fellowship where you can kind of see some different regional training, and there's 1,000 different ways to skin a cat. So get really great training over here. Really happy with where I'm at. I think it's made this year exponentially worth it. I think it's gonna help me, succeed hopefully quite a bit. But it's something in a place I really like. It's a good place to look into for sure.
Yeah, do you feel like because I'm originally from Indiana, kind of thinking about going back. Do you feel like a lot of the podiatrists there in central Indiana like to have a fellowship trained doctor or just doing residency, completing AB, PM, maybe FAS, and then getting signed on at hospitals?
It's tough to say. I would say overall, it kind of matches the trends around, nationally. I think especially in the Midwest, being from Ohio, I think some of these areas around here are, I think they're more, starting to look in the direction of some fellowship folks, but I would say by and far there's, more people coming out of residencies, getting jobs and fellowships, and I wouldn't say it's a huge push or need right now, but I think, it might be different if you go to California. They might be a little bit more stringent on, hey, we're looking for fellowship trained people. A lot of these things too is, when you're looking for jobs, if it's post fellowship or post residency, you have to kind of educate folks on what exactly the fellowship is, because as Trent mentioned, like not all fellowships are created equal, just like all the residencies aren't created equal. So you got to kind of have a breakdown of what you've done in that time. And then when you're going to jobs, you can explain that and show that even if you save cases and things like that, and having a full repertoire of what you've done in that time. So long story short, I don't think it's something that right now in our profession things are a requirement, like a fellowship is a requirement, but I think in time we might see the academic positions at universities or things like that. It might trend to that way, but it's a pendulum. It'll go over one way and back the other. So just something to think about.
Tyler, if I can add real quick, I mean, I've been out for less than a year, but not one single person. So we have a referral system or basically a system that says, how did this patient get to us if they're a new patient? Is it, is it Google? Is it a referral from a friend? Is it, they just walked in and saw us? Not one single person has said, I wanted a fellowship trained podiatrist. A lot of the referrals, a lot of the people that are going to kind of wind up in your office, it's really, really big to kind of have like an advertisement or even just honestly Google reviews is the biggest thing that pops up is just how many stars you got next to your name, the word of mouth from other, people in the area. It's really not so much the patients that care as much, I'd say, as more so the job offering themselves is really what it comes down to. The patients, as Zach said, they don't know. They don't know any better. They know that they got a bunion and they need it, that it needs fixed. So friggin' Joe Schmo walking down the street in a white coat, if they see a doctor, it's a lot of kind of the social and perception image of, what comes with it with, how nice is your office, your Google reviews, stuff like that. But yeah, it's really more so kind of the job itself to get in the door, which I think the fellowship does a little bit of job of getting you familiar with.
Makes sense. And then the
Just
other
to
part
add,
is just the business.
sorry, Tyler. But just to add one more thing to that, I think mentality as far as fellowship goes and where I think it'll be safe for you if that's what you do lean towards instead of thinking like, oh, the hospital, they want to see this, they want to see me do this many cases in fellowship. I think if you're going into it, first go into it with the intentions of just bettering yourself and having like a self-centric view of why you're doing fellowship and I think other things will follow afterwards because I think if you go into it sometimes for the wrong, like going into it thinking like I'm pretty much only doing this because I think hospital XYZ will hire me at university of whatever. Um, I think you got to go into it with the mindset of I'm doing this for me. I'm doing this because I want to be more efficient or see this pathology, do things that align with your career goals, but and some of those other things will follow along
Perfect. Thanks, Zach. Thanks, Trent.
for
Can
sure.
you guys hear me?
Yes, sir.
I just wanted to add something about finding a job, kind of like a hack. I feel like I just learned from a buddy who is a third year resident. He's in Tennessee, and he went to the like Tennessee Podiatric Medical Association, whatever it's called. Each state's got their own thing. He went there and he just talked to like everyone that he saw about jobs. And, he met a couple nice old guys and all their friends, all his friends were all their podiatrists in the state. Basically ended up getting like 4 job offers and like 4 different guys wanting to sell him their practices. Um, and that was kind of like a testament to me. Like if you want to go somewhere, and you want to meet people, but you don't want to cold call them, because I always just felt like that was kind of weird. Just like calling up practices. And, I'm sure you can do it. People have got jobs that way. But go into one of these like state medical association meetings and just meeting everyone there. Um, you'll get just from that one kind of one experience from my buddy. Like you can get a job, I feel like pretty easy just doing that, going and meeting kind of everyone there. And yeah, so a little like finding job hack for you guys there. So it's kind of all I got. Well, I was going to say
I
too,
second that,
something
Nate,
that,
by the way. That's
okay.
that's exactly the
I have
same thing in
I have
Virginia. Yeah.
I have
Yeah.
one thing too is when I went to courses, I would talk to other people at the courses, um, and they'd be like, "Oh yeah, I was looking at jobs so and so in this area, and I applied so at this job, but it didn't work out. Oh, you're looking at that state here? Why don't you contact them because they're still open and they're taking applications?" And I found a couple jobs that way too.
Did any of you guys find anything just by like applying like online?
Yeah.
Because
No, everything
I
I
felt
did
like I was
online never came back. It was all word
same.
of mouth
I
and
felt like I
or
was
like
just
cold
throwing
calling or
my name into
referrals.
like a black hole. Yeah, okay.
One
That's all of mine was
ours was
word of
online.
mouth. Yeah. Really? Wow.
Yeah, yeah.
I had
Cool.
good
Okay.
experience with something online too. I didn't end up taking the job, but I I went through some sort of listing somewhere, and it was like 3 months later they got a hold of me. So um, it's definitely possible. I do see what you guys are saying. It is like throwing your name in a black cloud somewhere and hoping to God something sticks. But once again, I think that goes to everyone's point is you gotta throw your name out there in multiple different ways and something will hit somewhere. But
Real quick, just I like what Zach said about um, fellowship. I think if you do a fellowship solely based off of like expecting to get a better job, or expecting to get a job where you are from or something like that based off the fellowship, there's a good chance you could be disappointed. Now, I will say a lot of the fellowship trained people I know have really good jobs, jobs in like orthopedic groups and stuff like that. But they're not like in locations that are near their family. They went out, like for example, one of them is in New Mexico, and it's not like he doesn't have family from New Mexico, but he found a really good job there, and they were only choosing someone who had done a fellowship, podiatry with a fellowship. So you can find better jobs, but if you're wanting to do a fellowship just based off of like solely based off of thinking that you'll get a better job in the location that you want, I think you might be disappointed. But 100%, and I think it could even be any fellowship. You know, I know some fellowships are better than others, but more training is never a bad thing. So I think if you're even considering doing a fellowship, like you maybe even think, oh, like I haven't done a lot of this or a lot of that, like 100% do a fellowship. I always thought it was surprising, like my attendings that were like, why would you do a fellowship? You know, like they just were, I don't know, just so much doubt in doing a fellowship. I think fellowship can really only be a good thing. Yeah, it is like one more year, but you think of other specialties that have to do, you know, multiple years, and our training's already less than other surgical specialties. And so at the end of the day, yeah, I think fellowships are a great thing, and more training is never bad. And the more training you get, the better you make all of us look as a podiatry community. And so, yeah, that's my thoughts. I ended up not doing a fellowship for a lot of different reasons. I actually got a fellowship, but the fellowship director got really sick. And actually, my second choice, the hospital ended up ending the fellowship, and then my third choice, the hospital ended the fellowship. So it was like, I feel it was like. Plus, I have 4 kids and a family, so I feel like it was like God telling me, like, do you know what? This is not for you. Just go get a job. And I ended up still finding a really good job, and everything's worked out well. But I really feel like the more training you get is never a bad thing. So if you're considering a fellowship, definitely do it. And being a part of this group, the CMC group, the STEPS group, you'll definitely have a lot of connections to fellowship programs and stuff like that through all the people through here. So
Yeah, those great points. And I think to add to that just quickly is no matter what you decide to do, whether it's job right out of residency or fellowship, even especially fellowship too, like you still got to work your ass off to get a job. It's not like just because you do a fellowship that things are going to magically pop up for you. Now you might make, different or new connections, but you still, regardless, you really have to work for it, unless you're in a situation where it's like where you're going right away, but still got to work no matter what.
Uh, Thomas makes a great point. Here, what he just put in the comments here, and I think big one is like if you're gonna go straight out into private practice here, one thing you've got to be on top of is billing. So I guess if you're transitioning straight into private practice, as a resident, I wish I would have done it a lot more. Granted, I'm getting it now. Uh, is to experience yourself to a ton of billing and what you need to like documentation and wording and specific codes that are linked to specific procedures, because it's no longer uh, you know, you just going in and doing the surgery. You've got to find ways to make money on the back end, or else you're just doing this for fun.
Don't get paid 75K though to take some fellowship that just has you doing bunions and hammer toes though. Don't do it. Look at the cases that the past fellows are doing. Make sure you're bettering your training because there are definitely some out there, but make sure
Yeah.
you guys are elevating your training and making it worthwhile rather than just, like I said, getting some extra letters on your name.
Hey,
Any other?
so to you back off of what you guys are saying. Sorry, I'm a second year medical student, so this is kind of just trying to see what's going on in the community and get some better understanding of just where our field is going. Quick question though, where did you guys, and this may be a naive question, where are you guys getting the training for billing and the CPT coding? Are you finding that you're getting more of the understanding of how to bill and code in residency? Or I know one of you guys mentioned that fellowship is where you kind of really learned the nitty gritty.
Very
So
good question.
yeah, and I'll be brief in my answer. Kind of what I've done, what I started to do at the end of residency, and what I do in fellowship here is actually, um, there's there's this. I don't know if you guys can see that. There's this book. It's a CPT code book. It's an Optum podiatry code book. It has pretty much every CPT code, every diagnosis code that we would use as surgeons in foot and ankle, and basically whatever cases I have that week, I go forward and I write down what diagnosis codes I would do, what CPT codes I would bill, and then I go into cases and talk about it with my attendings afterwards and say, hey, is this how you build it? Is this how you and make changes there? You can do that in residency. I wouldn't focus on that right away, but once you get into third year residency and if you choose to do a fellowship, it's proven to be okay for me, but different ways to do that all across the board, and you're about to hear some.
Do you mind throwing that book up one more time? It was a little blurry.
Yeah, one thing I do, I didn't do as much billing in residency. Got a little exposure, nothing crazy. It was just like billing office visits and stuff. But now in fellowship, like I, I get my attendings notes, and those have the diagnoses codes, and they also have the CPT codes, and I go back after the procedure, print his op notes and how he's wording it, and then I also go back and check what CPT codes he's putting in after the procedure, and I'm just linking all that together to know kind of like exactly what Zach's doing. That's the best way to go about it.
I just learned when I started. I had a couple people I did a little bit when I was in residency, but I just had a couple people um, just really focus on it. And basically, they would look over my notes and my charges and just kind of give me feedback like, hey, you could have added this, or hey, you put a wrong modifier on there. Um, there's multiple seminars, there's multiple coding books. We have like a bunch of billing resources where we're at too, where we have some consultants that help out. But it's definitely the hardest part. That's, in my opinion, the hardest part of transitioning from, training to being on your own is the billing and the coding for sure. It'll come with time.
Okay, thank you. I appreciate it. Oh, also, to piggyback off of something that Nate said, with some of his friends that are in ortho groups, are you saying that a lot of individuals that are going that ortho group route that they almost need to get a fellowship to be competitive? Like, is that still a thing?
Well, so the ones that I know that are in ortho groups, they get like all the big trauma. They're getting all the crazy stuff. Like the messages I get from them are like on a every other day basis, and it's always something that I'm like, dang, it's always big stuff. So, and that's because the whole ortho group is sending them. They're getting referrals from all over the place. Whereas like if you're at a private practice, you're not really getting a lot of referrals from other doctors other than, maybe some primary care physicians. But I think if you do go to an ortho group, unless your residency training was like really, really top notch, a lot of people, it's hard because, you kind of have to generalize some of these things. For example, like Trent, even though he didn't do a fellowship, I know he got amazing training in Virginia, so he's going to be able to do anything that's in an ortho group. But just in general, a lot of the residency programs, like you come out and you might not be totally adequate to go to a orthopedic group right away, and that might just be my opinion. But a lot of the stuff that I'm seeing, some of the stuff that this guy does, in particular, one of them that's in New Mexico, like it makes sense why he did a fellowship, or why they required a fellowship before he went there. I don't know if that answers your question, but yeah.
Okay, thanks. And then Trent, I believe you said that you didn't do a fellowship. Do you mind sharing whether or not you went private practice or hospital?
Yeah, I went to private practice. We
Okay.
got about,
Do you mind touching?
sorry, go ahead.
I was just wondering if you mind touching on why you went private practice versus hospital.
Being completely honest, only job that was there.
Okay, cool.
I looked at hospitals too. I tried calling some, I tried applying. Um, ultimately, I was actually looking at staying in Virginia originally, and then my wife and I just kind of came together and said, going back to Ohio, being closer to both my and her family was more important to us. So I'll be totally honest with you. I took the only job that I was able to get in Ohio at the time. I've actually, being honest with you, I've switched jobs already once from when I first started.
When this will start working.
So that's kind of my experience.
Okay, thank you.
Yeah.
I had one last real quick thing to say about billing and coding. I really didn't learn much billing and coding residency. I kind of thought I did. But when you realize that how much money you make relies on your billing and coding, at least for me, I learned like 95% of the most important billing and coding stuff very, very quickly. I'd say I became very good at it within like a month or two, just because I knew, I've got 4 kids, right? I was just trying to make as much money as I can, but also be a good doctor. And so when that's kind of on the line, you'll learn what you need to very quickly. That's kind of my experience. So
Your billers will catch stuff too. You're not
yeah.
submitting to the insurance claims. They'll catch things that you don't.
And I talk to my biller or my coders pretty often, making sure that I'm doing everything how I'm supposed to. So that helps.
Do you guys bill to like a direct podiatry biller or a general medicine like billing company?
I have my own direct. We have like our own within billing.
Okay.
I'm at a hospital, so they just have like billers, but it's like I use the same. His name's Jordan. He does all of my notes, so like he knows how I write my notes, and um, I don't know. I feel like I actually don't know if he's been doing podiatry like only for a while, but he knows his stuff really well, so it seemed to work.
Cool. 7:59. Anybody got any last minute comments?
Thank you guys for joining tonight. It's a really good discussion. Hopefully, out of all of our babbling, you got something out of that. We do this every month, so it's a different topic, academic, whatever, every month through our organization. So we're happy to have all of you. We hope to have more. We hope to reach more people. So if you could spread the word for us, let us know if you liked it, didn't like it, what we could do better. So we're always open to different things. But thanks for taking the time on a Tuesday night to come see us. Trent and I and the Steps board, we really appreciate it.
Yep. Thanks, guys. Have a great night.